Good afternoon. On behalf of the Philippine League Against Epilepsy, I would like to thank the PMA and through its president, Dr. Benny Atienza. Um, Welcome din sa mga estudyante, mga teachers po na nandito ngayon. So this afternoon, I will be talking about topic, no? Na kadalasan naririnig natin at kadalasan marami tayong naiisip na mga konsepto tungkol dito na naririnig natin na napapasa-pasa pero karamihan ay mga maling pag-aakala. So itong hapon na to, gusto kong bigyan ng linaw yung ibang mga bagay-bagay na maling konsepto tungkol sa sakit o karamdaman ng epilepsy. So let me start by quoting Maya Angelou, no? You may not control all the events that happen to you, but you can decide not to be reduced by them. No? Very significant ito para sa isang taong may kapansanan. So ano ba ang sa epilepsy? So ang epilepsy ay ang ikaapat na pinaka-common na neurological disorder, no? At ito ay nakakaapekto sa lahat ng tao regardless of age, kahit bagong labas, kahit oras lang ang inilalabas, pagkalabas sa sinapupunan ng nanay, maaari kang magkaroon ng epilepsy. Ito ay characterized ng unpredictable seizures and can cause also other health problems. Ang epilepsy ay isang spectrum na condition wherein there is a wide range of seizure types and control varying from person to person. There are a lot of public misunderstanding, no, that epilepsy can cause challenges that are often worse than the seizure itself. So, madalas natin naririnig yung seizures at epilepsy at kadalasan pinagbabaliktad natin ito. But we have to understand that seizures and epilepsy are not the same. Ang seizure is a symptom, no, wherein there is a transient occurrence of signs and symptoms due to an abnormal or excessive or synchronous neuronal activity in the brain. Whereas ang epilepsy is a disease that is characterized by an enduring predisposition to generate epileptic seizures and by the neurobiological, cognitive, psychological, and social consequences of this condition. So yung seizure is an event, no, or a symptom, and epilepsy is the disease. So a person is considered to have epilepsy if they meet any of the following criteria. They should have at least two unprovoked, no, seizures occurring greater than 24 hours apart. No, pag sinabi nating unprovoked, it is not caused by fever, no? Kadalasan kasi pag nagkukumbulsyon, akala natin dahil lang sa paglalagnat, no? Pero maaari kang magkumbulsyon ng walang lagnat. Or it can be one unprovoked seizure and a probability of further seizures similar to that of the general recurrence risk, which is about 60% after two unprovoked seizures occurring over the next 10 years. And if you have been diagnosed to have an epilepsy syndrome. So, when is epilepsy resolved? No, as of this time, no, worldwide, wala pa pong gamot na naiimbento para makapagpagaling sa sakit na epilepsy. But we usually consider them resolved if an individual who had an age-dependent epilepsy syndrome but are now past the applicable age, or those who have remained seizure-free for at least 10 years with no seizure medication for at least 5 years, pwede na natin sabihin that their epilepsy has resolved. But being resolved does not guarantee that the epilepsy will not return. It only means that the chances are small and the person has the right to consider that he or she is free from epilepsy. So ano bang nangyayari, no, when a person has a seizure? So seizures can take many different forms, and seizures usually affect different people in different ways. So hindi ho lahat ng tao pare-pareho ang klase ng atake, no? And not all parts of a seizure may be visible or easy to separate from each other. Every person with seizure will not have every single stage or a symptom. So usually at the start, a person usually experiences an aura. This is a parang warning, no? Na this is a warning, parang a warning sign, no? And this may be the first symptom of a seizure. The middle or the seizure is called the ictal phase, and this correlates with the electrical activity of the brain. And as the seizure ends, no, pag patapos na siya, meron tayong tinatawag na post-ictal phase, and this is usually the recovery period of the seizure. No? Some people, they recover immediately, while others naman will take a few minutes to a few hours for them to feel like their usual self again. So who gets epilepsy? No? Gaya ng sinabi ko from the start, epilepsy and seizures can develop in any person at any age. And they are more common among young children and older people. Usually, 1 in 26 people will develop epilepsy in their lifetime, and people with certain conditions may be at greater risk. So each year, about 48 of every 100,000 people may develop epilepsy. And according to the CDC, at least 3.4 million in the US live with seizures, including 470,000 children. In the Philippines, approximately 1 million Filipinos are affected and more than 65 million worldwide. So ang dami, di ba? So ano naman ang kadalasang sanhi ng epilepsy, no? Causes of epilepsy are actually may vary by age of the person. Some people with no known cause of epilepsy may have the genetic form, no? And about 3 out of 10 people have a change in the structure of their brains that causes the electrical storms of the seizures, no? Some people or young children may be born with a structural change in the area of the brain, and this may give rise to a seizure. And about 3 out of 10 children with autism spectrum disorder may also have seizures. So, infection of the brain is one of the most common cause of seizures. No, people of all ages can have head injuries. No, those severe head injuries happen most often in young adults. No, in middle age, no, yung mga older people, their seizures may be secondary from the stroke, or they may have a tumor in their brain. And again, like I mentioned earlier, it can be secondary to an injury. For older people, yung mga lolo't lola natin, the most common cause of seizure or new onset seizure is stroke. Now, let me give you common causes of seizures by age. No? In the newborn period, usually this is caused by brain malformation, meaning hindi nag-develop ng normal yung brain nila at the time when they were still inside the tummy of their mommy. No? And sometimes lack of oxygen during birth can cause seizures. Low levels of yung chemicals in your blood, like your blood sugar, calcium, magnesium, and other electrolyte problems can also cause seizures, no? And inborn errors of metabolism, intracranial hemorrhages, and maternal drug use, no, can also cause seizures in the newborns. Now, for older infants and children, the most common cause of seizures is fever. Ito yung tinatawag nating febrile seizures. Other common causes are your brain tumors and infections. For children and adults, other conditions like congenital conditions, Down syndrome, tuberous sclerosis, neurofibromatosis, no, can be causes of seizures, as well as genetic factors, progressive brain disease, no, gaya ng dementia, Alzheimer's, no, and head injury. And like I mentioned earlier, stroke is a common cause of seizures in the elderly, as well as Alzheimer's disease and trauma. So, ano kadalasan ang nagtitrigger bakit nagsi-seizure ang isang pasyente, no? Especially kung meron kang sakit na epilepsy, no? Seizure triggers are factors that precipitate or provoke seizures, no? They may make a person with epilepsy more likely to have seizures in certain situations. And this could change the number and the severity of your seizures. Learning if you have triggers can help you learn what to do next, and modifying your lifestyle or the environment can lessen the risk of triggers. So, here are the common triggers, no? If you are already a person with epilepsy and you're taking maintenance medication and you missed your medications, that can trigger your seizures, no? And also, ang isang pinaka-importante, no, that we have to reiterate, especially among the young, lack of sleep or disrupted sleep can also cause seizures, no, can trigger seizures in a person with epilepsy. Illness, with or without fever, can likewise trigger seizures, as well as psychological stress. Heavy alcohol use, no, and use of illicit drugs, no, cocaine, marijuana, ecstasy, and over-the-counter drugs or prescriptions can also trigger seizures. So it's important for you to understand na, limbawa, kahit may sakit kayo, tapos hindi kayo magpapakonsulta, bibili lang kayo ng gamot sa butika, and then iinumin nyo yung gamot na yon, you have to be very careful because there are some medications out there kahit na safe siya sa ibang tao, paminsan kapag uminom ka ng gamot, pwedeng mag-trigger ng seizures yon para sa'yo. So other causes are nutritional deficiencies, no? Like vitamin deficiencies, mineral deficiencies, poor eating habits, especially yung mga nagfa-fasting, those who are not drinking enough water, no? Or those who are dehydrated. And sometimes, nagko-coincide din yung seizures nila during their menstrual cycles. And these are usually caused by hormonal imbalance. And sometimes, flashing lights and patterns, no, can trigger a seizure. Maybe that's the reason why some of your doctors would tell you na you limit the time that you are in your computer or when you're watching TV, no? Kasi sometimes, no, the flashing lights can cause or trigger seizures, no? Specific activities and noises or, well, actually yung food not so much except probably for caffeine, no? And alcohol. So, maraming katanungan, no? Ang maraming nagsasabi is epilepsy inherited, no? Heredity plays an important role in many cases of epilepsy kasi we have genetic epilepsies, no? Generalized epilepsy is more likely to involve genetic factors than focal epilepsy. In recent years, genetic links to some form of focal epilepsy has also been found. There is a slightly higher than usual risk for siblings, no, o yung mga magkakapatid to develop epilepsy since there may be genetic tendency in families for seizures and epilepsy. And most children of people with epilepsy do not develop seizures or epilepsy. But since genes are passed down, it's still a possibility. Dapat din natin tandaan ng epilepsy is not contagious, no? Hindi po nakakahawa ang sakit na epilepsy. Hindi mo siya, you cannot catch it like parang ubot sipon, no? Na pag na-expose ka or COVID, pag na-expose ka, pwede kang mahawa. Sa epilepsy, hindi po ganun. So, isa pang katanungan na madalas tinatanong is, will I always have seizures, no? About 6 out of 10 people diagnosed with epilepsy can become seizure-free within a few years with proper treatment. And many of these will never have seizure recurrences or hindi na bumabalik, no? And for the rest, in about 30 to 40% of people, they will still have occasional breakthrough seizures or side effects, no, of their medications. The outlook in the first year for people newly diagnosed seizures about 5 to 6 out of 10 people will be seizure-free after using the first medication tried. No, as long as they're given the right kind of medication. A second seizure medication may still help in 11 to 20 out of every 100 people to become seizure-free. This percentage goes down as more seizure medication is added. No? So you have to understand, minsan hindi kaya lang ng isang gamot ang pagsi-seizure sa isang taong may epilepsy. I have seen or managed cases with 5 or 6 drugs on board, no? Before we are able to control, and sometimes kahit na ganun kadami na yung iniinom nilang gamot, nagsi-seizure pa rin sila. These are what you call yung drug-resistant epilepsy. 25 out of 100 adults will also develop further seizures. In children with new onset seizures, 74 out of 100 will become seizure-free within 2 years. Uncontrolled epilepsy may be seen in 9 out of 100 children, followed for a number of years. So about 9%, no, of these children will have drug-resistant epilepsy. Now, outlook for people naman with seizures and epilepsy at any point in time, about 60 to 70 out of 100 people may get control of their seizure after a certain number of years, no? But we don't know if this means complete control of both seizures and side effects. At least 30% with epilepsy, people with epilepsy at any point in time have uncontrollable seizures. And up to 50% with epilepsy report bothersome side effects of their seizure medications. No? Factors that may improve the chance of being seizure-free is one, of course, having a positive response to the first 1 or 2 seizure medications. No? There is no known history of brain injury or abnormality. If you have a normal neurologic exam and normal EEG, kasi even if you are a person with epilepsy, hindi ibig sabihin na normal lang EEG mo, wala kang epilepsy. Kasi may mga porsyento po ng pasyenteng may epilepsy, normal po ang EEG nila. So, if you don't have any family of history of epilepsy, malaki din yung chance that you can become seizure-free. And having an unknown cause for your epilepsy also increases the likelihood that you can become seizure-free. So, ang isa pang tanong is, will I have to stay on seizure medications all my life? Kasi dun yung iba na babother sila, no? Gaya ng sinabi ko, if your seizures go away, you may be able to come off your seizure medication. But of course, this has to be with your doctor's advice, no? Meron kasing iba, tinitigil na lang nila. Kasi sabi nila, after 2 to 5 years, pwede naman akong maging seizure-free. Yung iba, biglaan nilang tinatanggal, which is medyo delikado po, no? Hindi po natin to na-advise kasi delikado po yung biglaang pagtanggal ng gamot nang hindi po tinitaper off, no? The length of time a person is seizure-free before stopping his medication depends on many issues. So the longer the time the person is seizure-free on medication, the better the chance of him coming off medicine. More than 50 out of 100 children will outgrow their epilepsy, meaning mawawala na lang ito ng kusa. People who have surgery and become seizure-free may be able to come off seizure medication, but some may stay on medications to prevent seizures from coming back, even after surgery. So what if I am still having seizures while taking seizure medication? No? If you continue to have seizures while taking your seizure medication, you need to ask the following questions, no? Unang-una, tama ba yung diagnosis? May epilepsy ka ba talaga? No? Or do you know what type of seizure you have? Meaning, kasi some medications are, some seizure types, they have specific medications that they respond to. No? So, importante na malaman namin kung anong klaseng seizure yung sa inyo. Kasi maraming klase yan. And can you tolerate the medicine side effects? Kasi paminsan, isa sa side effect ng gamot is dumadami pa rin yung seizures nila. No? And Of course, importanteng tanungin is, can you afford the medicine, or is it always available? Baka naman yung dahilan kung bakit hindi nawawala yung atake mo kasi dahil sa kamahalan ng gamot, hindi mo pala iniinom according dun sa the way it was prescribed. Kagaya, for example, kung dapat 3 times a day, once a day mo lang siya iniinom, ay hindi ka nga talaga gagaling o hindi talaga makokontrol yung seizures mo. And do you know how to take the medicine? And can you take it on a schedule na sinabi sa'yo ng doktor? No? Pag sinabi na every 8 hours, importante as much as possible to follow na you give it every 8 hours. Hindi pwede kung kailan mo lang maalala. So how serious are seizures? So actually, most of the seizures end on their own. Kung mapapansin ninyo, pag yung kagaya sa amin, pag nakakakita kami ng mga pasyenteng nagsiseizure, di kami nagpapanik. Minsan nga, bakit hindi ka nagpapanik? Kasi alam naman namin na most of the seizures, they usually end on their own. Wala kang pwedeng gawing intervention, not unless na masyadong matagal na that we can give mga medications, pero on its own, most of the time it ends, no? During some seizures, um, binabantayan lang natin because people can injure themselves and they may develop medical problems that may be life-threatening or maybe an emergency. The overall risk of dying for a person with epilepsy is only about 1.6 to 3 times higher than the general population. However, we need to understand that there is one condition known as sudden unexpected death in epilepsy, or SUDEP, no, that is the most common disease-related cause of death in a person with epilepsy. Although it is not frequent, it is still a very real problem and people need to be aware of its risk. So kami, bilang neurologist, we usually advise our patients, no, about this condition. So ano pa ba yung ibang other mga myths na kailangan nating i-debunk? So maraming nagsasabi that people with epilepsy are mentally ill or they are emotionally unstable. This is not true, no? Epilepsy is a functional physical problem and it's not a mental one. Because of the chronicity of the illness, some people may experience psychiatric comorbidities. Ito na yung na-mention kanina ni Dr. Calleja, no? Persons with chronic illnesses, no? They may develop anxiety, depression, aggression, and sometimes part of the side effects of the medications they are using, they may manifest some form of parang uh, uh, anxiety, depression, no? So you need to just alert your doctor about these symptoms because this can be addressed too. Another myth is that people with epilepsy aren't as smart as other people. Again, I have to tell you that this is not true. No? Epilepsy has little to no effect on a person's ability to think, no? Except during some seizures, wherein during a short period following some seizures, and sometimes as a side effect of certain anti-epileptic medications. I am proud to say that I have patients who have graduated summa cum laude. Summa cum laude, they graduate valedictorian. There are actually doctors who have epilepsy, even lawyers who have epilepsy, no? And another thing that people say is that people who have seizures can't handle high pressure, demanding jobs, or can't go to school. At marami ito marami kaming naiinkwentro ng mga eskwela at mga teachers na porket may epilepsy ang isang pasyente, hindi na nila tinatanggap, no? Ang person with epilepsy, they can do these things, no? And they do. Did you know that about 70% of person with epilepsy, may hindi mo nga alam pag nakahalubilo mo sila na may epilepsy sila. So most schools and professions can and should accommodate a person with epilepsy. So sinasabi din nila pag nagsiseizure ang isang tao, nasasaktan sila. Well, actually, a person usually are often unconscious, no? Or their awareness are altered during a seizure. So wala silang nararamdaman. Afterwards, The patient could feel some discomfort, no? Kasi syempre, kung halimbawa nangisay siya, medyo masakit yan sa muscles, no? Pero, or kung nakagat nila yung dila nila habang nag-seizure sila, syempre, masakit yun. Marami rin nagsasabi na ang epilepsy ay isang sumpa, no? Epilepsy is not a curse. It is not a punishment from God, no? And it is, and you have to know that it is a medical condition. Karamdaman siya. Basically, kagaya ng hika, kagaya ng cancer, ng diabetes, ang epilepsy ay isang medical condition at pwede po itong gamutin. So people with epilepsy can continue to have a normal, productive, and happy life. The importance of getting proper treatment and adherence to medication cannot be overly emphasized. Epilepsy should not be a barrier to achieving. Person's quality of life, however, may be affected by the frequency and severity of seizures, the effects of their medication, and other associated neurological disorders. Some types of epilepsy are more difficult to control than others, but majority are quite easy to control. So let me end with this, no? I have epilepsy, but please don't call me an epileptic. We refrain from using the term epileptic anymore. We call them persons with epilepsy. Sometimes I just don't feel like myself at all, and sometimes I have a fit and fall, no? But soon I'm back on my feet again, and then I can go on with my work. So, and I feel fine at the end. No? So that ends my lecture. But first of all, I would just like to show this video on what to do when the person has an attack of epilepsy. I will not share the audio anymore. I will just annotate, no? I would like to thank the PCMC, no, for these slides. Ito yung mga maling bagay na ginagawa, no, kapag inaatake ang isang bagay. Pagmasdan nyo itong lalaking nakaitim, yung nakaupo na may hawak na menu, no, siya yung ating pasyente. So, they can be normal, no? Hindi natin kadalasan malalaman o masasabi kailan umaatake ang isang seizure. So, pante lang siya, nakaupo siya, naghihintay siya ng order niya, no? Mapapansin mo, ayan, ito yung sinasabi nating parang first part. May nararamdaman siya, no? Maari itong pagkahilo o pananakit ng ulo, no? So nararamdaman niya na pwede na siyang atakihin. At ayan, yun na nga, inatake siya. Pagmasdan niyo tong dalawang taong rumorespondi sa kanila, wag niyo pong gagayahin yung ginagawa nila. Hindi po natin kinakagat yung paa o daliri, hindi ho tayo naglalagay ng kahit na anong bagay sa loob ng bibig ng isang pasyente kasi sinasaktan lang po natin sila, no? Wag niyo pong gagawin 'yan. Hindi po kayo makakatulog at wag mo silang bubuhusan. Ito naman po ang dapat niyong gawin kapag nakakakita kayo ng isang pasyenteng inaatake, no? Again, pagmasdan natin itong ating itong lalaki na nakaupo, na nakaitim, maaring yun, normal. Wala siyang nararamdaman, nakapag-order pa siya ng kakainin niya. Okay? Hintayin natin. So, ayan, no? Nakakaramdam na naman siya. No? Ito yung tinatawag nating aura. Yun, bumagsak. So, ito yung mga dapat nyong gawin. Kapag nakakita kayo, itagilid nyo lang po yung pasyente, no? Huwag nyo siyang lalagyan ng kahit na anong bagay sa bibig niya. Luwangan kung nakasinturon or ano. Tapos, yung ulo, suportahan ng malambot na bagay. para hindi siya nasaktan o hindi nababagok yung ulo niya, no? Tagilid lang siya, samahan. Importante rin na orasan ninyo kung gaano katagal yung atake niya, no? At diyan lang kayo sa tabi ng pasyente. Importante na wag din kayong magkukumpulan, no? Para yung sirkulasyon ng hangin, no? Maging maayos para sa kanya. Gaya ng sinabi natin, kusa naman pong kusa pong tumitigil ang atake kahit wala ho tayong gagawin. So, ganyan lang po. Hintayin lang po silang matapos. At importante, ayan, unti-unti, humihina na yung atake, no? At huwag nyo siyang basta iiwanan, hintayin nyo siyang magkaroon ng malay at mahimasmasan. Okay? So, dyan po nagtatapos yung lecture natin. Maraming salamat po.